CPA was founded in 2004 by two psychologists working in the NHS. They were frustrated that they weren't able to use the full extent of their training because services were becoming increasingly resource-led, so they decided to set up independently. We're children and family specialists, so from our early beginnings we've always done a lot of work with looked after children, mainly in residential childcare settings and independent special schools, fostering and training for other specialist areas of practice such as substance misuse or adult learning disability settings, but primarily we're children and family specialists. We work nationally and in more recent years our service has expanded into mainstream education, and that's now a key area for the organisation's growth. One of the features of CPA is the employed status of our team. We're quite unique in that we're not an agency, we're not a list of associates or self-employed colleagues, it's a fully employed team, and that allows us to take responsibility for the quality of support to the team, peer supervision, and making sure that our practice is compliant with all of the external regulation and guidelines. We're able to take psychology into the settings where it's required, which benefits children, families, and those staff, whether they be residential care workers or teachers who are supporting the children in those frontline settings. That's completely different to the traditional model whereby children would be referred into a whole range of different agencies, which leads to a more fragmented way of working. Our team are made up of both clinical and educational psychologists who join us either from the NHS or from local education authorities, and we're attracting a high calibre of candidates from across both of those sectors. The quality and the integrity of our practice is very important to us. We're guided by Healthcare Professionals Council, British Psychological Society, the Association of Educational Psychologists, all who issue governance guidance on practice, recording, confidentiality, etc. We're very clear that as a practice-based organisation, supporting the team to be able to deliver the very latest evidence-based practice on the ground, that is the value of what we offer. In terms of our model of delivery, we offer an integrated service, so we work with our client organisations to understand what their needs are on the ground and what their current strengths are, and then allocate a psychologist to be embedded into their system. So that means that the range of work the psychologist can do is very, very broad, and it's not a one-size-fits-all approach. It's very tailored to each setting. So yes, that can often involve assessment and intervention and guidance on treatment programmes, but often it's about the governance of practice, it's about consultation to staff teams building their knowledge and skills, it's about staff training, it's about support to the management of organisations on their policies, procedures and approaches. So often the work is a mix of those activities across a system. There's a very strong evidence base for that, and it squeezes much more impact out of the service and delivers much better value for money. The philosophy of CPA is about applying psychology in frontline settings in innovative and creative ways. It's about trying to support the organisations that are working with vulnerable children and families, supporting the staff in those organisations to have better knowledge, more confidence, more capacity, and ultimately to improve the outcomes, to do that in a sustainable way, to do that in an ethical way, and to find new ways of taking psychology to where it's needed rather than the traditional models.